Hey, friends. Welcome back to another episode of the ASAP Pathway podcast. I'm your host today, Dr. Stacy, and I'm with my good friend and colleague, Dr. Susan Maples. Thank you so much, Susan, for being here.
Delighted to be here. I love what you're up to.
I
Love
love what
working
you're up
with you,
to.
Stacy. I'll never say no to you.
Oh my God. I just love you. I just love you.
Uh,
I totally fangirl you. Anytime I talk about you, for those of you who don't know who she is, I've done an amazing podcast with her before in the past. Check it out. Um, she is just such a leader. She is just so progressive, and what she has done in her community, I could have a million podcasts with her because she's just so innovative, and she's a disruptor in an amazing way in our profession and in her community. Um, and the last podcast we had, we really talked about total health dentistry, like what your practice is like,
mhm.
and the role that dentistry has in health and wellness, and we have a seat at the table with our medical colleagues to really change the the feel of healthcare and how it should look. And it's changing. It's changing. And you have an academy, Total Health Academy, that can help other dentists with this. And the website's totalhealthacademy.net. Is that right?
Correct. Correct. Yes.
Let's talk a little bit about that before what we're going to talk about today, everybody. If you're listening, like, what are they going to talk about today? Collaboration in the community. But I want you to understand what Total Health Academy is before we go into collaboration, because at ASAP Pathway, we're huge into collaboration. You can't do this without a team. And what
Yeah.
Susan Maples has done in her
I'm not.
community is
I'm really not here to sell anything. My thing with Total Health Academy was helping people create total health practices. Um, and what resources are there really to do that A to Z? This ASAP pathway is airway, sleep, and breathing disorders for pediatrics, and so it may not be for everyone. Our practice serves people from 0 to 100. So, and we do all aspects of total health, meaning, of course, we do lots with kids. Kids are my passion. But we also, it's cardiovascular disease and diabetes and chronic systemic inflammation from food sensitivities and nutrient deficiencies and fungal infections. And I mean, the list goes on and on. So, how do we treat people as a whole and use our brains to help people get healthy rather than just our tools to fix the ramifications of disease? Like, we are not carpenters in
right.
dentistry. We know how we have some good carpentry skills, but I liken it to, a firefighter. If you were to uh, turn the corner to your home and see your house is on fire, would you call a carpenter to fix the roof while the flames are still licking at the floorboards? Or would you call a firefighter to put the fire out and then stop and say, all right, what caused this? Because we're not going to rebuild around the same root cause, right? So we've got to fix the cause and then get a restorative plan and ultimately put it back together better than it was. But the the root cause problem is an issue. And someone asked me the other day, I mean, I don't know if people realize we're in the largest, most gruesome health decline that humans have ever known
Right.
because it's non-communicable disease. So we don't expect to adapt to this. This is a lifestyle related problem. And someone asked me the other day, do you think we're going to be healthier in 100 years than we are now? And I said, sadly, and I'm an optimistic person, but there's no way we can be. I mean, if you look at what's happened in the last 100 years,
Oh gosh,
the
Susan.
decline is so swift and deep, and there's such a chasm now that climbing out of this is going to be horrific, and it doesn't have any end in sight. So in 1980, you asked me a specific question about Total Health Academy. Let me just mention that it's an online learning curriculum for you and your teams to eat this elephant one bite at a time, depending on what interests you.
Mm.
So you basically go to school at home or in your office. And people can go home and watch a module and come back together and think about how they want to implement or, integrate the next chapter of their total health journey into practice. So it is a way to, kind of, again, if you were looking at a menu and decide what you're hungry for next, how is it that we continue to add more pieces that attract people who are interested in health in your community? Those, by the way, are our best patients, right? People
Yes. Yeah.
who value health share our values, and therefore they appreciate what we're doing. They'll gladly spend their own discretionary income on health. They're not reliant on insurance for everything. And it brings us to this whole wellness community in our own communities. About half of my patients are referred to me by physicians. Those are fabulous referrals. They're strong referrals. And once I fix the root cause and get at that, then I have a restorative plan, ready waiting, that I also get to do some of my best and finest dentistry. So there's a whole lot there. But it teaches people how to make that paradigm shift and how to add one piece at a time. I will say it's probably the only thing in today's hiring climate that creates tremendous amount of buy-in so that people become part of um, um, a culture that has purpose, right? And if they can buy into significance, they're not leaving for more money or better benefits. Like, we're having a real hard time in dentistry attracting and maintaining the right people in our
Yeah.
practices.
That is for sure.
Um, and if we can create that level of continual learning and buy-in, not just that helps the practice, but that helps the individual team member and their family get healthier. Now we really have some momentum in terms of long-term stability and longevity. I had recently had a team member leave. Um, she got herself into some shame, embarrassment, and left, but she's now back working for me a day a week. And she said, "You have completely wrecked me." She was like, "I'm working somewhere else and I'm constantly talking about you and this practice and what we do." And she said, "It's really hard to work anywhere else." But now, of course, we've replaced her, so she can't get back in. But it's been an interesting journey. So
Yeah, it
Total
is.
Health Academy would serve you if you want to, and you can take a look at it and even, sign on for 6 months. You could do just the pediatric version, pieces of it, the hands-on learning lab, the um, nutrition carries, the breathing, infant oral health exam, sleep and breathing part, if you're a pediatric dentist, or you could go with all of it if you are considering yourself a primary care dentist or a general dentist.
Well, what I
So
love about this is like what you said, when you get that patient that comes from the physician, there's already this trust level built in. Like, if you have a physician that's already handing off a patient to you, that patient already says, my physician believes in this dentist. So there's already a barrier that's been knocked down. They already have a level of trust for you. Um, it's the same thing with your team members too. I think when you have a practice like this and you develop a community within your practice, you develop a community outside your practice, it allows you to take your practice to another level. You could potentially become independent of insurance companies because you're so
which we
unique,
are,
which
for
you
sure.
are. And it's a very unique situation and it's very freeing to be able to practice and have the autonomy and not have insurance companies telling you how to do XYZ and we're only going to pay this and you have to write this off. I mean, that is crushing dental practices right now. Is
I know, and
the
I'm in an area where it would be very unusual. It is very unusual to be non-par, and we're in a very small town, and really the center point of the original Buick Oldsmobile Cadillac headquarters. So Lansing, Michigan. So, everybody's insured, and it is, it has been sort of a, kind of an audacious thing to become non-par, but we did it in Independence Day 2000. We've been working at this for a long time. and it's been very successful. Aside from the successes of the practice, the impact it's made on the community, we were named in the Business of Significance in the Entrepreneur of the Year awards 2 years ago, which is crazy to think that my practice is now 39 years old. It was 37 years old at the time, could be the Entrepreneur of the Year award for our state capital, right? That's crazy. But it's because we've had a big impact in the community. We're going to talk a little bit more about how you can have an impact in your community as well. It is the right thing to do. One of the things I was going to tell you about physician referrals is for anybody feeling insecure about creating these collaborative relationships with physicians, because in dentistry, we've had a history of being intimidated by physicians because we don't speak their language. But I will tell you, we know a lot more about what they know than they know about what we know, because oral health is left completely out of the medical curriculum. So now that there is a shift to integrate it back into the body, the mouth back into the body, they stand to learn a lot more than we do. And if we can all humble ourselves and learn together,
Mm-hmm.
um, we are we're in a beautiful place to be able to not teach and preach, but just to share information back and forth. And the best way you can do that is really through your own patients, right? Write
Yes.
letters that educate them about what it is you notice and how it impacts the work they're doing.
Well, that is exactly, and this is what I say to, like, we'll be in our WhatsApp group on ASAP, and they'll say a new member might come in and say, "How do I get this cardiologist to understand, or how do I get this ENT to understand, or how do I get this pediatrician to understand?" Look, sometimes the best way to educate your colleagues is just send an update letter. It's those progress letters. It's, thank you for your referral letter. It's, here's where we're at in the process letter. We finished treatment letter. Here was the before. Here's the after. Um, because everybody's busy, and sometimes it's just, a subtle communication of this
Absolutely.
continuity of care, and I think our medical colleagues, I mean, they're afraid to step out of their box, their paradigm, and refer to us. So it's super important to have that communication so that they feel comfortable. Like, when I send you a patient, Dr. So and so, is this going to fall into the abyss? So, it's about having good communication with them. But let's back up the train a little bit. Like, how do you, like, I know how I got started and Tracy got started in our communities. But when I first saw how you built what you did, it was at the ADA, not this year, the past year, last summer. I watched a lecture on your collaboration. And I mean, my jaw, I was just sitting there with my mouth open, because what you have done, it is not easy. So it takes grit, it takes persistence, and you have to, like you said, you have to be open to the fact that there's going to be some hurts. So, how did you have to put ego aside and get yourself out there. How did you start? First of all,
Well,
who did you start even talking to? What doctors did you go to? What kind of doctors did you go to? And how did you do that? And then
Well, I
nurture it.
recognized a need a long time ago because I know we can't do this on our own. When you start to really learn all the connections between the mouth and the body, and you start to realize, like, if I got a patient who's elevated A1C and they keep adding more medications to blood sugar and now they're on insulin, like, well, they have chronic periodontal disease and there's a bidirectional relationship. Until we solve this disease, they're never going to get it. The physician doesn't understand that. We have to talk to them, right? So that letter writing piece became critical to education. But I did, we did something brave. We have a three-pronged mission statement in our practice. And the third aspect of that mission statement, and the mission statement for us is real. Somebody recites it, somebody says it every day. Um, because we know that that is a statement of day-to-day purpose. We can evaluate ourselves every day based on how well we're doing at that mission. So the first leg of the mission is to treat every person with integrity, respect, and kindness. That's a lot to unpack right there. Then the second piece is to help every person take a significant step toward their optimal oral and systemic health at each and every visit. So we're helping people choose the level of health they want, take one particular step, and move toward that their sense of optimal health. But the third statement is to serve as leaders in our community in the quest toward total health promotion and the partnership among all health professionals.
Mm.
Now, my team members reluctantly refer to it as the quest because the quest is in there, right? But the quest is real. We have to, in our office, this is part of what we do. We serve as leaders in our community in promoting total health, which means collaboration, and the partnership among all health professionals of helping our patients recognize that they need to be well cared for. So we're the ones that hold the container for all of that. We're the ones to make sure that there's even a question on the health history for pediatric and adults and infants. Do you feel well cared for by your medical team?
Hmm.
Like we want to make sure if they feel like just just a number or just like not attended to, we're there to play matchmaker to help them find the right person. Well, how do we find the right person to refer them to? We've
Amen.
developed
Like, how do we find that doctor? How do we find that team?
yeah.
That's
So I have a woman whose role in my practice is called Health Relationship Coordinator, HRC. She is a registered dental assistant, but she's become so much more. She has an office and she works with our sleep docs and she does our sleep studies and she helps with she does a lot, but um, she does a new patient coordination. She writes all the letters between hygiene and our preventive visits and the physicians we refer to. She helps organize community events. I mean, she does a lot, but
now,
she,
is she in? So she's part of your practice, this
yeah,
HRC role. So
yes,
you have this role within your practice.
yes, it's
And let me
huge.
ask you this, because
We
this
could
is
talk
why
about her for just an hour.
I
Yep.
was just going to say that piece. Okay. There's going to be a lot of doctors, a lot of dentists listening right now saying, yeah, but I wouldn't add that right now. I don't have a need for it. When do you add that? Sometimes you have to build that position first. Like if you build it, they will come.
I was on a retreat with one of my study clubs and it occurred to me that I should do this. And I basically left at the break and called her and said, I want you to consider this role. And I don't know what the role is going to entail yet. But she was a dental assistant. So I thought maybe part-time, half-time she could do this. And then it quickly butted into a full-time and then some position. Um,
So you had faith, really. Like it is that if you build
Well, I
it, it
made
will
a list of
come.
things that we could be doing better in that relationship, but you have to recognize that um we when people say, do you have a specialty practice? I mean, we have a practice that attracts people seeking health. They're sophisticated healthcare choosers, right? We need people we need a person to attend to all of that. If I'm going to attract people and get referrals from physicians, I need to treat them the way they would like to. So if you ever look in the wellness, and some of you listening are already seeing a wellness doc, you see an integrated medicine doc or functional medicine, or um, track some of these things on your own. You wouldn't think of getting blood work without an inflammatory panel. You wouldn't look at you're tracking your vitamin B levels and your D levels and your A1C and your your homocysteine, like all of these things that we have learned that help us create optimal health. And we're not just throwing supplements into our body because we should have them. We're chasing after optimal levels of health so that we can live our best life, avoid things like COVID or whatever. But
Right, right.
building immunity, looking at gut health, looking at microbial diversity, looking at what are the indications that I'm healthy and what do I need to do that. We do everything from, you know, at our new patient exam, if they're interested, we do um, uh, body mass. Well, it's a we look at the distribution of their weight in terms of muscle, water weight, fat, and where it's distributed, and take a look at, trying to get that visceral fat level down below 10, and kind of we're really looking at the whole picture. We're looking for sleep and breathing disorders. And of course, when you attract people who are interested in this, you also have to do some follow-up. You need to use the information on that patient to educate their physicians about what we're doing and find them
So,
good physicians if they're not in there.
so
Right.
let's say someone marks on the health history. I don't feel well supported or cared for by my current medical team. What's your next step? How do you do the matchmaking? I guess the HRC person helps.
Right. So what we do is after our new patient process for adults is 2 hours. Um, it's more like 2.5. We set aside 2.5 because a half hour goes to the financial aspect of the practice where we're helping them forecast and level up some coming appointments and sharing expectations. That's that last half hour. But the first hour, 40 minutes to an hour, is an interview where we're really having a dialogue. It's a verbal health history, really, where we're asking them to tell us what is it that's most important to them about their health, what's most significant, what are they currently working on, what aspects are they curious about. So we're really getting into the mindset of their own health journey. And through that discussion, and of course that includes oral health, we do get on to talking about oral health and what's it been like to have their mouth, and where are they in the process, what do they know about it. Then when we move to the clinical examination, I'm gathering data in the mouth and I'm comparing it to what they know. So now I have a firm basis to talk to them, where I'm not, it's very personalized, and it's very much like, here's what your understanding is, here's what I see. They could either be very much in sync, or sometimes I see something that they totally don't realize, but I will talk about it differently depending on their mindset on their own health. And our goal is to help take them further toward their optimal health. So when I look at what they're currently battling with, and what their focus is, then I can find, between Jean and I, my health relationship coordinator, we can find, we absolutely, it will point to the physician they need to see for what.
Okay,
And
so
I've
oh,
and I
go
built
ahead.
referral slips for all of them. So you know how
So
you
unique
refer for
referral.
endo,
Yes,
and
yes.
yeah,
So
yes,
and that's what we like. And I said this to a member not too long ago when, because we have letters in our doc center, like you need a specific letter for the ENT, then you do a cardiologist, then you
for
do a
sure,
primary care
for
physician.
sure, for
So you
sure.
have all of those different types of letters
Yes.
too.
So we have, like, if they need nutrition coaching, they need weight loss, they need hormone balancing, they need airway support, they need ENT, we have created this network of physicians, and we have referral pads for them that we
That
created.
you created.
Yes, by
Yeah.
interviewing the physician and saying, we want to refer to you, and what are some of the aspects that you love to treat and treat really well? And we have them on there just like you would check boxes
Checkbox.
on an endo slip or
Like,
something,
and then
right?
maybe like a little perforate, like you just tear it
It's a
off
tear off.
and
Yep.
you give it to the
Has the map
patient.
on the back and the whole 9 yards.
Yes.
Or if they
Yes.
choose
So
to put
intentional.
like a house, like if it's our wellness cardiologist, we might have a heart screening thing on the back, or something that they wanted to put on the back of the referral. But
So, how did you have? And I think it's different now than it was even pre COVID is different than post COVID, how I introduce myself. These lunch and learns, and nobody's doing hardly any lunch and learn. I don't hear about it anyway. I hear less about lunch and learns. And then, with the
well,
sunshine,
physicians were used to lunch and learns because all their drug pushers come in, right?
yes, but a
They
lot
buy
has
them lunch, and
changed with the
yeah,
sunshine.
yeah,
So the Sunshine Act is, you can't bring you can't bring goodies anymore, or you you can still bring referral pads and papers and pens, but I think even that you have to be. So I think a lot of offices have kind of, especially if they're not private, they're part of a hospital setting, they have to honor the rules for the Sunshine Act. But how would you recommend now someone listening? Because you got to kiss some frogs before you find a prince. Like you got to put yourself out there, reach out to offices. What would you say now? Like, how do you put yourself out there as a dentist to find that ENT, to find that functional medicine doctor? I mean, obviously, we're going to Google local functional medicine doctors and we have to figure out who's going to want to be possibly on our team. How would you go about doing that now?
I guess you have to ask yourself, what is it that you're looking for in an ENT first? So you know them when you see them, just like dating, Stacy.
Yeah.
Anybody, you got to know what you're looking for.
What are
So
we
when you know
looking
them, you see
for
them, right?
here?
But part of it is that, people always we want an ENT who's willing to take out tonsils when I tell them to take out tonsils, instead of saying we want an ENT who's willing to learn and grow and think with us and take a look at the mouth a little bit differently. And that means setting their ego aside and learning what we know, and also looking at the literature together. Their literature is different from ours. They're looking at different journals, right? And what you realize when you do a research project is every single piece of authentic research only gets published in one journal. So the ENTs are only going to publish in one journal, and so are we. And so they don't see ours and we don't see
See
theirs. That's
theirs.
kind of unfortunate, isn't it?
It really is. I
You
mean,
can find them, but it's about doing your searching and stuff. But it's not like running in front of our feed. Um, so one of the things that I think about is, what is it are we that we're trying to accomplish? We're only looking for one person in each specialty, at least one person who's willing to grow with us. So I'd like a really good myofunctional therapist. I'd like a really good ENT. I'd like a really good sleep physician who also deals with children. In the case of ASAP, right?
right.
I'm talking about this one aspect of our practice, right? I want a really good pediatric orthodontist, or I'm willing to do it. Tracy and I do most of the arch development, expansion, and advancement of our two to 6-year-olds, right? Because we can't get
That's
an
the
orthodontist to do it.
population that no one's,
Well,
yeah, yeah.
and even my orthodontist, like they call expansion, you know, 36 millimeters of intermolar width. I'm like, we're not done. Hello, we're not done. So it's difficult. But I think that building that collaborative team requires us to share values, the values around caring about patients more than money, the values about, not that we're not financially successful. I don't want anyone to hear that, but caring first about the patient, um, and continual learners, and um, people who are um, willing to listen and have time to listen to the patient and have time to pick up the phone and collaborate with me.
That's okay.
We
So pick up the phone. Would
Well,
you
just
call
text,
them or
just text
text?
them.
You okay, because this is a
But
different age now. It's like, do you
but
call?
yesterday I text, and if I have a question right now that came up on here that I couldn't answer, and it had to do with total health, I would put it out to my wellness and prevention study club, and within minutes I would get 3 or 4 responses. And so and I'll talk about the wellness and prevention study club, but the other piece of it is that I'm more than happy to act as an advocate for patients and find where they need to be. If I can't figure it out on the spot, I'll figure it out later. But one of the things that we have to look at is um, how to use patient experiences to find these amazing people. So I asked that question, Stacy, do you feel well cared for by your medical team? And let me ask you the question personally.
Hmm.
Is there someone on your medical team that's Stacy's doctor who you feel like you have a really good relationship with and feel well cared for? Can you think of someone?
On my team?
Yeah, I no,
Oh
no.
yeah. Oh,
Just for your
okay.
body,
M-
your own personal
My
health care team.
personal, yes, I do.
You
I do.
do.
I
I
have
want
a
you to,
Yeah.
Okay. Go, what?
I have a really good OB-GYN who's very
Okay.
open. Yeah.
Awesome.
Yeah.
So a man or a woman?
Woman.
Okay. And what is it that is you like about her for you? What are the aspects that make her special for you?
For me, it's the fact that I don't feel rushed. We have actual conversations about my whole health,
Time, communication.
time, communication, and she's willing to definitely think outside the box. She's very open to um, bioidentical hormones. She's very open to supplementation and vitamin D levels and
So big picture, total health
big
thinker.
picture, total health thinker, and very open to collaboration. I refer
Love
to
that.
her too.
And
She's my
wellness
doctor.
focused rather than just sickness. So she's
Yes.
willing to spend time. A lot of physicians, they're so rushed right now. Not always their fault. And OB-GYN too, they get lots of pressure to
Yes,
move
they
on to
do.
the next patient. And unless you've got something real interesting going on that is not good, they're not spending a lot of time.
Mm-mm.
So what you just told me right there, express your values. So I'm going to, if you're my new patient now, and I ask you those questions in the new
Yeah.
patient interview, I'm going to say, Stacy, do I have your permission to just write her a handwritten note saying, thank you for being in our community because your doctor, shares our values. So now I'm just telling you more about me. I'm highlighting you to your doctor, thanking your doctor because then I turn right around and I write, dear doctor, so and so. We have now a mutual new patient. I just had a chance to hear from Stacy how much she values your care. And she described you as being a really good listener, really good communication, really good at having a mutual conversation and really being attentive to her total overall well-being and really open to her thoughts about her own health. I can't thank you enough. We need more doctors just like you. Are you willing to receive our referrals from other like-minded and like-valued patients?
Oh, I love that. This is a
So
handwritten note. This is a
I
handwritten note.
do. And I
Do
don't
you
hear
put
back.
anything in it like
No.
nothing? It's just
I
and
write I write PS. I started a wellness and prevention study club about 12 years ago, and we meet monthly at my dinner table. If you'd like to be considered to be part of that, I know you'd be a good fit just based on what Stacy shared. And then I let that go. Now, I rarely get a call back. Sometimes I do, but what I'll do is my health relationship coordinator will follow up.
okay.
She'll call the office and say, Susan has asked permission to refer some patients to you. Tell me about what the new patient experience looks like for you. Do you accept new patients? How often? Of course, all of my wellness docs that are in my wellness circle, they may not be accepting new patients, but they receive my new patients. So we have
Interesting.
special privileges because we belong to a network. The network is just the Wellness and Prevention Study Club. And by the way, I set up a very simple website for that. If you'd like to see it, feel free to get on wellness and prevention studyclub.com and take a look. But it's
Say it
features
again because I think that's so valuable. Wellness
and
and prevention study club.
preventionstudyclub.com.
I think everybody should jump on and look at what you've done. That's
Yeah,
pretty
so
amazing.
I mean, it's a very simple website, but it states our purpose and it talks about our mission, talks about our beginnings. But we have been meeting, annually. So I'm not trying to say you need to start your own wellness and prevention study club. I certainly happy to help you do that because it's been unbelievable for my practice for
Yeah,
the
it is
number of referrals from
huge
that.
when you
But
have created something within your community and I mean it's a lot of work. It takes takes
but
some
it
fortitude.
does. But the question you asked is, how do I find that person?
Yeah.
Don't underestimate the value of your patients for helping you. If they say they visited an ENT, they had a nose job, we tend to go, oh, that's a history. Tell me about your experience with your ENT.
So excellent.
How
That is
was
an
it for
excellent
you?
point because we don't always have that. Okay, you went to what doctor did you go to? How was that experience for you? oh my gosh, loved them, blah, 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 blah. And they're giving you all this information. Our
And then it
patients and
gives
help
you
us
a
find
way
these
to reach
people.
out and say,
Yes,
thank you for caring for our mutual patient. I'd love other patients to be cared for more like you. And I understand you're also a continual learner. I would love to have just a few minutes of time, some time to talk about what we might be able to do together. We need support. That kind of thing goes a long way. So if you had a question from a pediatric ENT, I would pick up my phone right now while we're on this podcast and I would ask Jason Chesney, blah, 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 blah. What do you think of this? And he'd write back to me. And I could tell you while we're doing this podcast, right? And it's a Friday, so maybe he's working right now. But I mean, when he can, he would get back. Um,
yeah, that's
so
huge. That's huge. And
yeah, so that's an
that's
example.
trust. You earn that through that collaboration and that ease of communication and that access of communication through time and
Yep.
trust. And so let's talk about
You've
that a
heard
little
about
bit.
many things this morning already. I've talked about referral slips that we created, the Wellness and Prevention Study Club, a network of physicians that value wellness and learning together. We haven't really talked about what that club looks like, but we've talked about it. We touched on community events. We do a lot of events for the community, even for our health professional community, not just for our patient community. I didn't talk about having focus groups in our office, but rather than going to them and doing a lunch and learn, we could have several practitioners come to us to learn more about, let's say, tongue ties.
Right.
That's been a big issue of contention.
Sure has.
Lactation, it could be about pediatric ortho. Why do we need to start under 6? All of those things, right? Um, Sleep, we could have something on sleep disorders for kids and have different. So there's different ways to set up events. You could do it for parents. You can do it for, but the all of these things that we do advertise, and I hate the word advertise, but they basically tell the world who you are
Tell
and
your
what you're up to.
story. Yeah.
Yeah.
And
Yeah.
so to nurture this and something you said, and people might listening might be going, wait, did I hear her right? They sit around her dinner table.
Yep.
That to me was you threw up a picture of this study club in your living room or your dining room, basically, all sitting around your dining room table with food on the table. And I just was like, what a beautiful thing. You invite people in. It's not like you're even meeting in a restaurant week or monthly, it's your home. Like, such a cool thing. How did
We
that
love it too.
start?
We love it. And there's probably about 30 in the Wellness and Prevention Study Club. My dining room only seats like a dozen. So we're it's sort of first come, first serve, but not everybody can come to everything. So
Right, right.
it's just a matter of whether they're available and the subject matters of interest. And but we have a core group of people and it's pretty amazing. Um, and because we represent all specialists in medicine, we have learned to speak each other's language. And what we really learn is none of us, I mean, we think, oh, it's us and the doctors. But trust me, the integrated medicine doc and the OB and the pediatrician and the myofunctional therapist or whoever, the nutritionist, the pulmonologist, we all speak different languages.
Hmm.
And we have to learn to speak their language or at least communicate in ways that were understood. So you don't have to worry about the sophistication of your letters, sitting down, making sure, but you also don't want to overwhelm them with oral speak that they don't understand.
And it's really having that conversation of when I send you a patient, what is it that you want me to know about referring to you? Because we always, a lot of times I think we spew out in the letter all the things we want that specialist to know that we're seeing. But what is it that they need to know to make a decision? How can we best communicate with them? You know, what do you not want to know? I mean, what am I over speaking on and what am I under speaking on? What do I
Yep.
need to and I said this to a patient this week, huge adenoids, huge tonsils. I couldn't see any obvious. She definitely is going to need orthopedics. She's 4 years old. She needs expansion. But I'm looking at these adenoids and tonsils, I'm like, they're huge. But what's huge? I mean, relative to the space it's in, what's her quality of life? Is she sleeping well? Is she breathing well? Like, I can't just send to an ENT and say large tonsils and adenoids. They're going to go, so? Like,
Right?
so
Yeah.
what? Like,
They'll
what?
shrink. Okay. No,
They'll,
but
yeah,
you
they're
have
going to
to, you
shrink.
also
Who
have to
cares?
include things like, um, you know, patent nares, but chronic rhinitis. Like, and if you're talking to, and you could talk about allergies and gut health and all that. If you're talking to an ENT, is going to get it. If I say melon potty score of 4 to an ENT, he might not even know what that means.
And people do not realize that. They
No,
think all ENTs are extremely airway minded as far as from a sleep disordered breathing perspective.
no,
They're not.
no. So they may know melon potty score, but
Yeah.
but I'll tell you that most physicians wouldn't, and most
Yeah,
dentists
most
wouldn't
right.
either. So you have to say something like, crowded throat opening. And I often talk about the AP relationship, that the soft palate is in a prone position is draped such that it's almost touching the posterior pharynx. And so we're crowded front to back, we're crowded side to side, and the tonsils are taking up some of that airway space. We've got a roadblock. And then I'm looking at the fact that their mouth breathing, now their nose is dysfunctional. This is called nasal disuse. Many of them won't recognize that. Now, ENTs, again, you need to know what they know. Again, this is why we need to talk to them.
Yes. It's
Like
have
if
a
I say the
conversation.
word nasal disuse, does that show up in your literature or is that just in ours? I'll say things like that, right?
Yeah.
Yeah, we have to kind of get on the same page so we can talk about, they're much more into the signs and the symptoms. They're not going to go based on the pediatric sleep questionnaire. They're not going to pay much attention to that. They're starting to recognize that there are sleep and breathing ramifications to large tonsils, but typically large tonsils were taken out based on their history of tonsillitis
Yes. And then back,
and the number of times
antibiotic
they had to
use.
antibiotic the child
Yeah.
and how many days of work of school they were missing from sickness. So this is a very big shift for them. And if they
What
all
is,
knew
go ahead.
what were you saying?
Well, what's interesting is if you look at the order, and it's something we had put in one of our modules in ASAP is the ENT 2019 ENT guidelines for tonsillectomy. And they have, what are the reasons that you would remove this lymphoid tissue? And really, if you talk malocclusion, malocclusion actually is above the tonsillitis and antibiotic use. So they have, things are changing. But you definitely have to list the why. In my early days of referring, I used to put enlarged adenoids and tonsils, you know, almost like I'm sending to the oral surgeon, please evaluate for extraction or please evaluate for removal. And so many parents were coming back saying they didn't know why I was there. They're like, why are you here? And they were a little frustrated.
Yeah.
And it would be like us getting an ENT referral, an ENT sending to us saying, number two, please perform buildup and crown. We would be like, who are you telling me to do a buildup and crown on number two? Right? Like, why are you telling me? Why are you here? So it's again, it's speaking their
Yep.
language and
Yep, it is. And I think that that's what I've learned over time is we all put our pants on one leg at a time. We're all really equal as people if you're sharing values. Um, we're all learning. If you're willing to hang out with people who are learning, it's a much more interesting career.
it really
And
is.
yeah, if you're hanging out with people that think they know it all and their shit doesn't stink, that is
Yeah,
just not that fun.
it's
It
not.
really isn't. But if you find people who are willing to learn, they're curious about what I know, and I'm curious about what they know. And over time, we know a lot more about what each other does and values and the criteria they use. And they're willing to see some things through our focus, and we're willing to see it through their focus. And
Yeah.
I can respect when they decide not to take out tonsils, and I want to know why. And then I'm not feeling like, dang it, what is wrong with them? I'm not constantly butting up. We know better. Why aren't they listening? Because I hear that a lot, right?
Mm-hmm.
Um, I want to know, where are we missing? I thought this was a slam dunk for you. What is it that you're seeing? And why is it that we're not willing to move forward at this point? And what else is possible here? Because this child's suffering.
This,
I kind of
yes.
want to
What are we
do
going to
that.
do instead
Mm.
then? Because, and I'm
And I
hearing,
also
yeah,
believe tonsils, we're on the ENT kick thing right now, but the we have to address so many more issues. Why did the tonsils get that way? Why are they mouth breathing? And many times it's because of allergies, and it is a gut issue problem. And we need to move away from meat that's antibiotic to death. 80% of our antibiotics come through livestock. We need to diversify a child's food. Many of these kids have gag response from high fiber food. So they're eating shit food, sorry, ultra
no,
processed
we
food that
talk
turns
real.
to
Yeah.
mush in their house,
Yeah.
mouth. And we need to help them figure out how to fix their immunity before again, I believe the tonsils are just like putting a new roof on a house while the fire's still licking away. It works overnight, and then it doesn't work anymore.
And then it doesn't. It's,
Mhm.
it could be a piece of the puzzle, but it's usually
It's a
not.
safe, it's definitely a first responder kind of thing. You
It
got a
is.
child suffering, and
Get
it
them
helps,
out.
but it
Right.
doesn't change what caused the problem to begin with,
No. It's just like what
which,
Christian Guilleminault said. I remember at the ADA symposium, I think it was 2017, the first ADA, pediatric ADA symposium, and Christian Guilleminault, who's the father
yep,
of sleep medicine, he gets up
yep.
there and everybody's just waiting for him to say something. And he's got this French accent, and he's up there and he just looks at the audience and he said, I don't know what sleep apnea is. And we're all like, how do you not know what sleep apnea is? But his point was, we still don't know.
No,
This
there's a lot we don't.
collapsing airway is a side effect of something else.
Yeah, for sure.
And we're
And
all
we have
addressing it.
all kinds of different root causes. When I look at how the human population has changed in 100 years, even the fact that we can get kids outdoors, outdoor play versus indoor play, and stop over sanitizing our world. We need some microbial diversity so that they're not all sick and allergied. We need exposure to bugs. We need to have kids dig in dirt and dig up
I was
worms
just
and
gonna
swim in
say,
a
go
lake
out
with their
there
mouth
and
open,
have a
and
little dirt in your mouth. Won't hurt
for sure. And
you.
we grew up on the side of we're playing in rivers and streams and lakes, and kids are growing up in their hermetically sealed homes in front of a screen, and really good with their thumbs on a phone. And I'm not, I think these skills are important, but they're definitely not the basis of health. So I
True,
think a
true.
lot of it is like, well, who's willing to address lifestyle? And here's the role, it's the hygienist. They've got time with
Yes, they
kids,
do.
and stop polishing teeth. There's no efficacy in that. Start talking to kids about you know uh, how to care for their own mouth, and showing you and teaching them. That's where the hands-on learning lab comes in. We do hands-on science experiences with every child at every visit. Our goal is to help a child have skills, beliefs, and behaviors, habitual behaviors for a lifetime of health by 18. And I'm not talking about oral health, because oral health, airway health, gut health requires that kids learn about their bodies.
Yes, so
And
true.
we're better to do it than in a science lab where they can play with stuff. So over the course of their career with us, they do 70 different science experiences, and then put on a white coat and follow me around. And now we have this weekend, I have another patient graduating from ortho, but I have 3 more patients graduating from dental school this year. We have, and 3 more heading to dental school. So we have like 49 of our patients now practicing dentists. It's crazy.
Good grief, Susan.
I know, right? From the hands-on learning lab, because a lot of these kids, by the time they graduate high school, they've already placed a sealant on an extracted tooth and looked under a microscope and done acid-base chemistry and done, looked at airway issues and I mean, they've done a lot of dentistry. They've screwed implants into a model. They've, taken an impression of their own teeth. They learn how to use an intraoral camera. They can read their own radiographs. I mean, we teach all this.
Good
It's super
grief.
fun.
It's
Super
so
fun.
great. It's so great.
Super fun.
Well,
Yeah.
again, everybody listening, you see why I freaking love talking to her. It is, I learn something every time I talk to you. I just, even from a personal growth and development perspective, like,
I'm your big sister, girl.
you are my sis. Like,
I'm
you
gonna be
are.
65 this year. If
I
I don't have some wisdom to pass on, shame on me.
I mean, but I think that's the beauty of this. Like, there's so much to learn from each other and having these
For sure, for
conversations.
sure.
And
I
I
learn from you
just,
all the time too.
I appreciate that. And well, we could talk for a million more hours, and I do want to
Our next
personally,
our next
yeah,
time together might be we'll do that for sure. Our next time together might be with Jean, my health relationship coordinator.
I would love that.
Because
I Let's do
her
it.
role in this has been huge, right?
Well, this is how you build. You've got to have the team to help you build your. You can sit
Yeah.
here and if you
Yep.
don't have the team doing this,
Yep.
guys, like ain't
And how do
happening.
I write a letter? How do I put together, I'm a general dentist, or I'm not a general dentist. I'm a total health dentist. But
Yeah,
if I'm doing, I want a series of photos on this kid to to look at their progression of their face and their mid treatment. And I say to my team, I want a series of photos. And I don't own an expensive like ortho program where it automatically populates it into a template,
template.
where yeah. So I say to Jean, I need a composite. Can you put this together for me? I'm going to submit it to my face focus group and ask questions. Like, somebody's got to do that for me. I'm not going to do it. So I need someone who can support the patient and this collaborative effort. And it's a beautiful role. So we'll do that. We'll visit with
That
Jean.
would be wonderful. And I think too, the point of it is you have to create the role first, then the referrals will come. Then the collaboration blows up.
Oh, yeah,
You
it's great.
really can't wait. Like, well, I just want to wait until I would, maybe I want a few more people referring before I create the role. I think you have to create the role. It's like that with anything unique and different in your practice. You create the role first, and then everything comes. And I would love to have your health
Well, ask
relation.
yourself, what would you do if money didn't matter? How would you orchestrate this practice best? You have to have the faith that the
Ooh,
money
that's
will
good.
follow.
And there is the faith. I've said that when we first got started, you had to step out in faith that by creating this role, like you said, if money didn't matter, how would you
I'm pretty
behave?
fearless though. Not everybody, a lot of dentists are very like, they want a business plan. They want to know that it'll work. They want to, but the thing is you can change your mind. You can say, this isn't working. What else is possible?
Ooh,
And
I like
develop
that.
and get someone in the HRC position that's willing to help you develop it. That it's a work in progress. We're invested together. It's
And I love what
exciting.
you just said. I believe in harmonic synergy, and I believe that things happen for a reason. And the fact that you just said what you said, you can just change your mind. Like it's so simple. You can just change your mind. I got a good friend sends me a quote every morning, like good morning, thought of the day. She's been doing it for me for sending them to me for probably 12, 13 years. Every morning I
Oh,
get one.
wow. Wow.
Nancy Addy. I'm just going to say who it is. It's Nancy Addy. She's the past president of the American Academy of Dental Sleep Medicine, and she's such a good friend to me. And she believes in harmonic synergy as well. But she sent this morning a quote that said, if you can change your mind, you can change anything.
Of
You can
course.
change your life.
Yep.
So, what
Absolutely.
you
It's a great
just said
message
was,
to
yeah, just change your mind. If that doesn't work out, change your mind, change it. I love it. Okay, I have to ask you some couple questions before we go. And by the way, I just realized those of you listening and not watching, you might hear some birds chirping, have heard some birds chirping. Of course, she's sitting on her beautiful porch this whole time. And I just realized I love listening to her birds chirp. So, in case you were like, what is that sound?
I'm sorry. I know I
Susan's
couldn't.
sitting on
I
her.
thought about taking it inside, but
No,
it's
it's
so
so
beautiful out here. I'm
beautiful.
looking at the lake, and I have a pickleball tournament in a half an hour. So I just was
Yeah,
like, oh, I just wanted to stay outside all day.
it's so beautiful. She's got this beautiful lake house, and I just love when she's at her lake house. Okay, ready? And I'll make it quick because you got pickleball. What is your morning routine? Real quick.
I exercised with my best girlfriend for 39 years. So we're early morning exercisers. So first thing I
What's
do is
early for
just,
you?
oh, I hate to tell you because it's really early, 5 o'clock.
Oh,
Not
okay.
today. Today we're doing 11 because but before work. And we do an hour of exercise. We mix it up. She's been an amazing influence on my life, and so I start my day with her, um, and that's gonna change soon because I'm moving a little further away from her. But basically I start my day with exercise.
Well, it shows those people that are just listening. If you check out the YouTube video, she's got some amazing arms. Um, wh- what's
You're
the
so funny.
what? Okay, what's your favorite movie?
Oh my gosh, that's a really hard question.
I know it's
I'm going
kind
to
of tough.
share with you my son's favorite movie. He's 30. If anybody has seen him on Brave Parent Podcast, episode 11, just a beautiful person, an
Hmm.
amazing person. I found the movie first and shared it with him. It's called Captain Fantastic. It's a misnomer. You probably haven't even seen it,
I've never
but
heard of it.
it's a guy who raises his kids in the wilderness and then intersects with the rest of their larger family who's been raised in a suburban community, and they come together in a unique way. And it's a really good look at what we've forgotten about who we're supposed to be, and what's possible, what we can learn from the wilderness, from nature. And I just think it's a fabulous movie. So that just comes to mind right now.
I love that. I gotta go watch it. I need to go
Yeah, I
watch
think
it.
you'll like it. I think you'll
And then
like
the
it.
final one, what's the best compliment you've received?
Oh wow, what a question. um I guess thank you for helping me find my way. I'm a pathfinder for a lot of people toward health, and that really speaks to my heart as a teacher. So I hope that today there's one or two things that you might have picked up that you enjoyed. And my love language is definitely affirmation. So if there's anything that helped you today that you feel like I should be sure and keep passing on, Stacy and I got on today, we started talking about our insecurities and our imposter syndromes. And as an educator, there's always like a way that I never want to abuse my influence, and I want to know that I'm helping people, and it's never about bragging about what I've done, but what can I do to help you, and what can you do to help me? So if I've done something that's helped you find your way today, I'd love to hear from you.
I love that. I'm going to give you another compliment. You just have a beautiful soul, Susan.
Oh
You
my
just
God.
really do. You have a beautiful soul.
Right back at you, girl.
Thank you. All right, everybody. Oh, look, we got little love hearts
It's
just
because I
popped up.
did this. It
I
pops up.
didn't know that. Do I?
Yes, you can
What?
do it
Oh,
too.
is this a new Zoom thing?
And if you do this,
What in
yeah,
the
I
world?
know.
Is
You
this
had your
only on
hand up
Zoom?
before, and a hand popped up. Did you realize that?
It sure did.
Yeah.
I'm I never
Anyway,
knew that. Oh my gosh, this is crazy. Okay, now everybody have to watch what we did on the YouTube channel. So that's really cool. I didn't know this was a thing on Zoom. Okay,
if you
cool.
make your hands into a little heart shape, it
It
flushes
it
hearts all over the
flushes hearts
screen.
everywhere and then peace signs. You get confetti. Like, I don't
Hmm.
understand. Okay. Oh, I just learned something new. Well,
All
thanks,
right, sweet.
Susan. All right.
Yeah,
You
we'll
have a
talk soon.
good tournament.
Thank you. All
Bye, hun.
right. Bye.
Bye, everybody.